Welcome to Book Talks, from books to Botox and everything in between. We hope you enjoy. We're just girls.
Breast implant illness is kind of a newer phenomena.
So if I get breast implants before I have babies, can I still breastfeed? Love you guys. Hello and welcome to Book Talks with special guest, Dr. Mija Khan.
Hello, hello.
We're so excited.
We're so excited. You're our first guest.
I'm so honored. This is my first podcast.
Could not be a more perfect person.
I know, it's going to be so fun. And we get to dive into all things plastic today. So
Yes.
it's going to be great.
And coming to you quenched and well hydrated from Swig.
We love Swig. I feel like no one knows about Swig.
If you're from Utah, you do.
You know?
Or if you're from the East Valley. If you're from the rest of the continent, this is like I think it's kind of like I don't know, like it's gotten a reputation, I think, but people are like, oh, Swig.
I love Swig. I don't usually love soda, but when it's from Swig, I love it.
What did you order?
I got a raspberry dream. It has I think coconut, cream, raspberry, and diet Dr. Pepper.
But it has raspberry puree in it, right? Because there's like little raspberry seeds you suck up the straw.
Yes, and that is the best part.
love
It's so good.
Dr. Khan, what did we
got
get
a
you?
Diet Coke with fresh lime. This is my first Swig, so
And?
it's been a wonderful experience.
Is it meeting your expectations?
It's exceeding.
Exceeding. Wow.
It's so good.
I've already had too much caffeine today. So I got a strawberry breeze, which is sparkling water with like coconut cream and fresh strawberries in it.
So yummy. I love
Sounds
strawberries.
It's disgusting.
All right.
Okay, so
if that doesn't get you guys a Swig sponsorship, I'm not really sure.
I
what
know,
I know,
seriously. We want to start off with a full intro from Dr. Khan.
Yes, Dr. Khan.
Tell us about your journey.
Putting me on the spot already.
How
I
did
know.
you get to where you are today?
So I decided early on, actually, when I was like 12. I don't know why. I was just like, I'm going to be a plastic surgeon. And so
So you knew plastics even before like I'm going to be a doctor. You knew like immediately that I wanted to do plastic surgery.
yeah, for as long as I can remember, like high school.
When you
Wow.
were little, have you seen those TikToks where their parents make the kids like do exercises, like they like surgery exercises or doctor?
Actually, my parents are like the anti-Asian parents because they were like, please don't become a doctor. Like,
Really?
begged me not to become a
No.
doctor.
Okay.
Yes.
Do you have any physicians in your family?
No, yeah, I do. And
Okay.
that's why my mom actually went to medical school for 2 years and hated it. She was forced to go
Okay.
by her parents. And she was like, this is a horrible experience. Like, I don't want you to do this. Save
Don't do
yourself.
it.
Don't
Yeah.
do it.
Yeah.
Well, part of me, I guess, was rebellious and was like, well, I'm doing it. I
Oh
was
my
told not to do it, so I'm
gosh.
going to do it.
So then you knew you wanted to be a surgeon at 12. I wish I was you. That's awesome.
Yeah.
And then
Aspirations.
Part of me just thinks I was just stubborn at that point. I was like, I said I was going to do this, so
Yeah.
like now I have to.
Okay, and you graduated from high school early.
Yes,
How
I was
old are you?
16.
Oh my gosh.
Could not get out fast enough.
yeah.
I don't know. I was just like so ready to be on my own and be out in the world. My parents asked me to like take a gap year and travel. Looking back, that probably would have been super fun, but I just kind of knew I had
Too
a long
much ambition
road
in
ahead.
that little body of yours.
Yes. So I just went straight to college. I went to Cornell, where I was for 4 years, and then from there to medical school at West Virginia, and then plastics, which is 6 years. There's actually 2 routes you can get into plastic surgery. You can do general surgery, where you're doing like gallbladders, appendixes, trauma surgery, all of that stuff for 5 years, and then you do a fellowship for 2. So it's a total of 7. Wow. But the newer route for people who know they want to do plastic surgery right away, they can do a condensed 6-year program where you do residency in plastics from day 1. You have other rotations mixed in, but it's focused on plastic surgery.
That's wild.
I love that they did that because they won't do that for nursing. You don't like get a choice of doing plastics in nursing. You know, we've talked about this before.
just OR.
Yeah.
Yeah.
But like even in rotations, like you don't get, or like with nursing school, you don't get like a class on like talks or fillers or anything either.
Nothing
you know?
in this
So
industry.
that's kind of awesome that they do that now.
So then where did you do your residency?
At Wake Forest in North Carolina.
Okay.
And so I was there for 6 years. And that's actually how I got connected out here to Dr. Malik. He trained at that same program just 20 years before me.
Wow.
And my mentors were some of his mentors, and they connected us and said, hey, you guys would be a great fit. I came out here for an interview. Was like, okay, cool. I'm single. I don't have a family that I need to move. I wanted to live on the West Coast my whole life. So
That's amazing.
I just moved out here.
So Dr. Khan works with our medical director, Dr. Malik, and you have been doing surgery at his office now for how long?
3 years. This July will make 3 years.
That's
so
amazing.
awesome.
Yeah.
And tell us, though, what you do for Dr. Malik, because you not only do plastic cases, you still do reconstruction cases. Tell us all about what you're doing right now.
Yeah. So my practice is evolving. I'm very, new still, I feel like, even though I've been here 3 years. When I first started, I did a lot of trauma call. So I would go to the hospital and see people who'd been in car accidents and do facial reconstruction. As I got, more established and started getting my own patients, the cosmetic stuff picked up. And then I really wanted to also have some contributions to the community. And I really love reconstruction. It's such a, cool part of plastic surgery.
Yeah.
I think that a lot of people don't see that side of plastic surgery as much because it's not as glamorous, but particularly breast reconstruction for women with breast cancer. So that's become a good part of my practice now. I'd say probably now I'm 60-40, probably 60% cosmetic, 40% breast reconstruction.
That's
really
don't do any
cool.
of the trauma
Yeah.
anymore, but
this brings up the point, though, to me, always when you go to the hospital, if you get a gash on your face, right, you can ask for a plastic surgeon.
Yeah.
In the ER. Like, please don't let anyone stitch your face
Why
up.
did I not know that?
I think, even in children, you can ask
What about
for
if you
plastics.
break your nose? Do you think you can ask for a plastic surgeon too?
Oh yeah, that's who they would call.
Oh wow.
Yeah.
I love that.
Yeah, so
Well, I would
maybe before you go to your urgent care,
Yeah.
think through where your scar is going to be.
Exactly. And do you feel like you like both equally?
Yes.
Yeah.
They're both rewarding in their own ways.
Totally.
Cosmetic, obviously, you're helping people kind of regain their confidence and build up their self-esteem and give them back something that they feel like they were missing. Breast reconstruction, you just become such a close part of these people's journeys. A lot of those patients have just become so near and dear to my heart. Like,
Yeah.
you spend so much time with them, and you're the only person that's like actually giving them any good news in their whole journey. So you're like the first ray of sunshine that they have.
The light at the end of the tunnel.
Yeah.
And you actually get to give them, the hope, and you actually see them for longer than most of their other doctors ultimately, because once the cancer part's taken care of, they're still you got to still make sure everything's healing and looks okay. And,
You do a lot of follow-up.
you do a lot of follow-up care. So.
And then they're starting to get their lives back again, too.
Yeah.
So you probably get to see the positive in that.
Oh yeah. You get to see them change so much over the course of, their treatment, and, seeing them through the whole journey at the end is just so rewarding.
For sure.
Yeah, and I feel like people kind of say oh my gosh, plastics, it's not that rewarding, all this stuff, but it really is. There's so many parts of it that people, I feel like, don't think about,
Well, even with our jobs, I feel like people look at nurse injectors and they're like, what a superficial job to be done. But helping women feel better about themselves is so fulfilling.
Yeah.
Oh my gosh. Yes.
Yeah.
So fulfilling.
Wild.
It's just insane, though. It's insane to me that people think it's superficial to do that. It's the same thing as getting a tattoo or dyeing your hair or whatever it is that makes you feel better about yourself.
Yeah.
Why not? Getting into shape. This is just a different way of accomplishing that. And a lot of it people can't do on their own. So it's
No.
why not get the help?
Yeah.
I also think there's been a huge shift in plastic surgery, and we've kind of talked about this a little bit, and I feel like we could do a whole podcast episode on it. But there's a shift in plastic surgery, especially facial plastics, from aging to improvement of appearance.
Yeah.
Before it was all oh, you got plastic surgery when you got old.
Now
Right.
it's
But
different.
now it's so different. I feel like now it's oh, well, I can do a brow lift and the way I look better. Or I can get a rhinoplasty and the way my nose looks better. Or a lip lift or whatever it may be. But plastic surgery is becoming less invasive and more done. Does that make sense?
Yeah, I think it's becoming more, not preventative, but more, small little tweaks that are less noticeable over time.
Yeah, for sure.
Which I think is great. You don't want to look like a different person. You just want to look like a slightly better version.
Yeah, I joke with my husband that he needs to save his pennies so
For
I can get my
facelift.
facelift at 45.
I know. That's
I
what
would
I was
way
gonna say.
rather look better in my late 40s, early 50s than
Facelifts are moving younger and younger because I think they're figuring out that it looks better when you're able to do it earlier.
Yeah.
So I think that
the small tweaks is such a big thing.
Yeah.
the industry's just moving in like the opposite direction, which is crazy.
Yeah.
And I think it's becoming more acceptable too. I think
Yeah. For
before, you know, a lot of people hit it or like didn't talk about it. And now that people are more open and, you know,
It's
wanting
not
to share
as
their
taboo to talk about.
Yeah.
No.
For sure.
Just like Botox, I feel like we've talked about how our moms, even like their group of friends, did not talk about whether they were getting Botox or not. But like our generation does talk about it, and we host Botox parties, so it's just not quite the same. I think it's just more widely accepted.
It really is, yeah.
Okay, Jenny's can't wait to ask this question.
Well, okay, so
Let's jump into it.
obviously your professional life is so amazing and you're so great. We want to hear about how your dating life is as a female plastic surgeon.
Oof, I don't even know where to start on this one.
Like,
much time do you have?
it's just, there's probably so much to break down here.
I mean, you've already divulged to me that you can't even really put it in your dating profiles.
Yeah, so I go back and forth all the time on this one. So I just initially I think I had it in there.
Yeah.
I think as of right now it's not on my dating profile. I don't know. I think it's not on there.
Okay.
I actually don't think I have profession on there at all.
When
I
do
like
you
it,
tell
keep it
them?
mysterious.
When do you tell them that you are a full-blown successful plastic surgeon?
When they ask. I mean, if they ask in like the first exchange, like I feel like what you do for a living comes up pretty quickly because
Yeah.
it's like, oh, sorry, I was at work, and then they're like, oh, well, what do you do?
Yeah.
Or whatever. So I'm honest. Like I'll ease into it. I'll be like, oh, I'm in medicine, and
Yeah.
like let them assume what they want.
Yeah.
But sometimes they like press and they're like, oh, like what area of medicine are you in?
They're like, oh, so you're a nurse.
Yeah, no.
Literally.
Honestly, like, that's obviously the first assumption. I'm a female, I'm young, so they're like, oh,
Doesn't
you're a
the
nurse.
feminist in you like want to like curl up and cry knowing
like-
that like you can't even share your profession in your dating
And,
profile?
like, how do they react?
Wild.
Like,
I mean, it
share-
is threatening.
It is. How do they react? Like, what is the main reaction when you tell them?
I feel like at first they don't really know what to think because they're just like, oh, whoa, like wasn't expecting that at all. And then I think like it slowly sets in. I think over time, too, I don't think it's like in that moment that they realize, it's like once they're like, oh, you're like going for surgery tomorrow, or like, oh, sorry, it was a long day. I ran behind because X, Y, and Z. And then they're like, oh, yeah, like you were like doing something important or whatever it may be. But I think the biggest intimidation factor in my opinion, experience has been like the financial divide that it creates.
Interesting.
I feel like men in particular have a strong desire to provide and protect. That's their role in a relationship. And when the financial providing is like threatened, they kind of, feel really insecure by that.
Yeah.
I was just going to say that I think by nature, I'm sure we'll get so much hate on this from men, but men feel like they want to be superior if it's financially, if it's in whatever other aspect. And when something is when they're feeling threatened, that's when they're reacting in like a weird way.
Oh yeah. And I've definitely had guys that I've dated make comments about that.
Oh, they have?
Oh yeah. But like early on too, surprisingly early on, like, oh, like, how do you feel about this? Or how do you feel knowing that your earning potential's higher than mine and all of that? And then, like, for me, it's so funny because I'm so new to this, right?
Yeah.
Like, I've been very poor for a very long time. Like, I was in med school and then residency, you get paid, like,
Nothing.
And I still have my med school debt. So it's not like I'm, like, living this extravagant life already. And it's like, you're freaking out about something that hasn't even happened yet. So, like, I don't know.
It's interesting too because I just feel like when you're dating and when you're starting to date or you're on the apps or whatever, like you're already kind of pretty vulnerable. Yeah. And men and vulnerability just don't go hand in hand, right? And then like add the element of like I just feel like they're like roosters, like they just want to like be the big tough guys, and especially they're going to present their best selves on these apps and in the first few dates, and immediately like you are below me.
But like,
I don't know. I am smarter than you, and I am cuter than you.
But like, where are all of like the confident kings that are just gonna sit back and be like, you know what? You are a successful woman. You make a great living for yourself, and I respect that, and I'm comfortable with that because I'm comfortable with myself. and I'm not going to focus on that aspect.
I know we read about them. They have to exist.
Yes.
I don't know. If you guys know where they are, let me know.
Like drop
every
in the comments. Like, please, at people in the comments. Because we are confused.
Yeah.
But you know what? It probably weeds out the gross ones fast.
Yeah.
It does, but
Yeah,
it's funny because like I have even had experiences where initially they're like, oh yeah, it's not a problem, and then like over time it becomes a problem, and you're like, I asked you, like very
this was
directly.
out in the open.
Yeah, this was out in the open. Like I told you very early on, and my expectation is so low. Like take me to Chipotle. I don't care.
You're not asking.
I'm not expecting you to treat don't treat me different.
Yeah.
Like if I'm a nurse or I'm a plastic surgeon, like our dates should be the same.
Yeah.
You should treat everyone. Yeah. Like why would anyone be treated not differently?
Exactly. Do you feel like true colors come out fast when it has to do with like financial burdens and all the things?
It just depends on the person and their level. Maybe they're just not self-aware either,
or
they've never been in that situation. So like they're like, oh yeah, it doesn't bother me. But then like over time, they're like, wait, shit, that really does bother me.
Yeah. I feel like too, men, we know, I mean, this is nothing against men, brains develop slower than girls' brains, right? Like, and we know they mature a little later than us.
Yes.
And then add in the fact that you kind of matured faster than most females, even. Like, you graduated early and you started your career so much earlier, like, it kind of offset it even more. And so, do you find yourself, like, leaning towards older guys, or do you still feel like you're kind of dating guys your age?
I really don't look at the age. I mean, I think on the apps, my age range is like maybe a decade. So like anyone in their 30s.
Yeah, for sure.
I'm 33. So like, I think I've dated somebody maybe even 29. Yeah. But I mean, I think I don't like to use that as like a hard and fast rule. I think
because people can be
it can be you could be immature at 40 and you could be really mature at 29. So I don't really look at that as much. I think a lot of men, though, like want to feel established in their profession and their career. So it does take them some time. So like, people who are in their mid 30s may be more likely to be established and be where they want to be in their career. I've had friends not in medicine say, that their significant other really wanted to wait until they, could financially provide for them to get married and have kids and all of that stuff. So I think it's just kind of a common, for sure, feeling amongst men.
I think one last thing I feel like about this financial subject and men and all that, I heard something from a girlfriend and I kind of stand by this, and it can be very controversial, but I feel like when you are dating, you kind of do want to date someone that's in your income bracket because you want to be able to live the same lifestyle and do the same things. And it can be hard, like say one person is making a ton more money and then the other person's not. I feel like down the road that's going to lead to, I don't know, like what if you wanted to go on a vacation and they're like, oh, I can't
we
go on a
don't
vacation.
spend money on vacation.
So I do understand, the insecurity that comes from men could be on that note of like, oh my gosh, I'm not making enough money. Like, what if I can't keep up, or I'm not going to be able to do all these things in the future? So maybe that's like what's adding to it.
Yeah,
too,
for sure. Know? Expectations is a lot in dating.
For sure.
Yeah.
And like to me personally, it doesn't matter who pays for things.
Yeah.
I mean, I think it's. I mean, we're in a new era in the world. It's 2024.
Exactly.
Women make a lot more money than they ever have, and so for like me to pay for dinner is like not a big deal. For me to pay for a vacation, also not a big deal.
Exactly.
Well, and you've like been, you take care of yourself, right?
Yeah.
Like we are in this era where if I want something, like I earn the money and buy it for myself.
Yeah.
Guys, drop your hats.
I know.
She'll pay for your vacation.
No,
I'm gonna date you.
Jenny's like, actually, sorry, Jake. Bring off.
Okay, so moving into our aesthetic.
Well, yeah, we just want to talk a little bit about common plastic surgery misconceptions that I feel like we hear, and like ask your opinion on certain things, just because I feel like, especially like with breast reconstruction and breast augmentation, there are so many misconceptions and like opinions right now. Like the internet's wild over it.
And it's funny because I do feel like plastic surgery on the internet is one of the biggest subjects that people just get wrong. Like there's so many things floating out there that I'm like, where did you hear that? Same with like Botox and fillers, but with plastic surgery also.
Oh yeah, for sure. I feel like most of my time with patients is spent kind of just getting through and just solidifying what is actually true and what they can expect, and kind of going over a lot of the things that they may have read or seen, and making sure that their information is correct.
What's the most common misconception that you get?
I don't know. I mean, I feel like it changes from time to time. I think the big thing that people are coming in just like straight up worried about is breast implant illness.
Okay. Tell us about what that is.
So breast implant illness is kind of a newer phenomena. We hadn't previously had a lot of information about it. I still feel like we don't. It is just a diagnosis of exclusion when women who've had implants over time feel like their implants don't agree with them for whatever reason. They start to get different symptoms, memory issues, fatigue, brain fog, muscle aches, joint pain, very nonspecific. They mimic a lot of autoimmune conditions. These women will go and get tested for everything, lupus, rheumatoid. They'll have lab tests done, their thyroid's checked. Everything comes back fine. There's no lab value that's like deranged. And then they'll have imaging, of their breasts, get their mammograms, those sorts of things. Everything's normal.
Yeah.
And so at that point, you can't say that it's not the implants. But, some women have their implants removed and they report feeling better. We don't know how to explain it. We don't know the direct link.
Yeah.
It's been studied for decades. There was a period of time where people thought silicone implants weren't safe in the early 2000s. They actually
Everyone started doing saline.
Yeah. They took silicone off the market, actually. You could not put silicone implants in.
That's crazy.
It's called the moratorium. Yeah.
Wait, when was that?
Late 90s, early 2000s.
Wow.
And at that point, the FDA did this like rigorous study of all implants. And if you know anything about the FDA is probably the most stringent body of regulation. So for them to put
in the world.
Yeah, in the world.
Like, literally.
I mean, like the United States FDA, like nothing gets past them. So for them to put the silicone implants back on the market means that they could not find anything.
No proof.
Of any sort of illness directly related to breast implants that are silicone versus saline.
Yeah.
And so back to breast implant illness, we don't know, basically, is the long and short of it. We don't know what's causing it. We don't know why certain people get it and other people don't. We also don't understand why some people can get it, as quick as a few months out from their surgery, or some people develop it, decades later. And so what I tell these patients when they come and they're frustrated and they've, ruled everything else out is, you don't need these implants to survive. They're not necessary. They're not, life-saving. Let's take them out and see how you do. Give it a full year. Let your body readjust. And if you're not better and you want your implants back, we can always have we can have a discussion about it. But I also can't promise you that you'll feel better by having them taken out.
Yeah. There's really no exact science to it.
Correct.
And I remember what you told me. So I'm a patient of Dr. Khan's. I had breast implants put in like almost 2 years ago.
That's crazy.
I think 2 years. Yeah, wild, right? And I remember asking you about it because I wasn't educated even as a nurse. And you said, bottom line is it is a foreign body.
Yeah.
No matter what, saline, silicone, anything. If you put in screws in your elbow, if you put in whatever, anything that's not already kind of there, your body may, your body may not like it.
Yeah.
So there's always going to be that risk there. But that makes a lot of sense to me. But it can't always guarantee that's what's causing the problem.
Exactly. And I feel like it's a huge subject on social media.
Yeah.
Like, just so many people getting their implants out.
Yeah. And I think it's just it's multifactorial. I mean, there's so many autoimmune conditions popping up in people who don't have implants. And so we should probably be diving more into that and saying like, what are the environmental causes that are causing all of these people to have increased levels of inflammation and increased, autoimmune conditions? Because it's not normal for everyone to have thyroid problems. It's not normal for everyone to have a gluten intolerance. Like, it's wild to me that there's so many people that are going through some sort of inflammation or autoimmune process. And it's like, it's
probably should find the root
yeah, we
cause.
should probably find the root cause. It's probably related to diet and what people are putting in their bodies and
lifestyle
the
factors.
hormones and everything that are in foods these days. So I think that the breast implants are a great cop out.
Yeah.
Also, I do feel like there's been a shift in trend from like larger breasts to smaller
We
breasts.
just said this, like 2000s till now.
Yeah.
Remember the rock hard like right up here. Sitting on your
so
chest.
I mean, it's easy to say like, I'm getting my implants out.
Yeah.
I'm being healthy.
I'm being healthy and I want a natural boob.
Yeah.
Like,
Yeah.
okay. Sure. You
It's
can
been-
chalk it up to that, but you just are just following trend.
Yeah. Like it really has trended in a different direction. That kind of leads into my question. I feel like breast implants are the lip filler of our job. Like you could easily go too big and it can go wrong really quickly if you don't pay attention to anatomy and product and all the things. Do you have a lot of women coming in wanting huge breast implants? What do you say to them, and how do you decide who can fit what size breast implants?
This is probably the hardest part of my job.
I know, right? I'm like, I'm one of them. So
Yeah. Setting expectations. So there's a couple of things that I really try to emphasize to my patients, and I feel like I'm very fortunate. The practice that I'm in is kind of known for a certain look, which is more natural, more understated. So I feel like by just being at that practice, like Dr. Malik's created this great reputation for, not doing crazy plastic surgery and just not doing whatever you want. So that kind of weeds things out for me a little bit.
Yeah.
But, we always have very candid conversations with our patients about the reasons that we choose a specific size. So, especially young, I feel like my patients are getting younger and younger. I mean, I did breast implants in a 19-year-old the other day. And so it's just so hard because you're trying to look at the lifespan of this person.
Yeah, for sure.
And you don't want to do something to them in their, teens, early 20s that they're going to regret later.
Yeah, because you are stretching out tissue.
Yeah.
Exactly.
That cannot really be shrunk back unless you're surgically removing skin.
Yeah.
Which is not always a great solution. So what I try to tell them is that I'm setting you up for your next surgery, which you are inevitably going to have. So once you have implants, you are guaranteeing you're having another surgery.
Because they're only good for
10 to 15 years, but you're either going to get them replaced or you're going to get them removed. Very unlikely you're going to live with the same pair of implants your whole life.
Yeah.
There are people that do, and that's fine. But usually, the lifespan of an implant, they say is 10 to 15 years. You should probably have them switched out.
Yeah.
And so when people come to me and they're like, I want X number of cc's because my friend had this number of cc's, that's probably like the worst patient to walk in
I
my
want
office.
500 because my friend has 500.
Exactly. And you're like, okay, well, there are a lot of factors that go into choosing size. First of all, like, where are you starting? Like, how much of your own breast tissue do you already have? And you can't compare that to anyone else because your anatomy and the way, your breasts sit on your chest wall, the width of them, the dimensions of them, all of that plays into what size implants can fit into that space.
Yeah, it's like, okay, even if you want to wear a size shoe 7, like, do your feet fit that? Because,
Exactly.
like, if you're a 9, you're not fitting into a 7.
Correct.
And if you're a 7, you're not fitting into a 9.
Like, you're not going to fit the RV in the car garage. You
No,
know what I
it
mean?
doesn't work.
It just doesn't work. And so what happens is people who go to places where they'll put in whatever size implants they want, they're disrupting normal anatomy in order to fit that implant in the space.
Yeah.
And so the next surgery is even more difficult because then you're trying to undo the damage that's been done. Once you have a large object in your breast 24/7, succumbing to gravity and forces of like jumping and running and being active, like it's just going to stretch the skin. I mean, anything that you put in there is going to be an added weight. So the bigger you go, the more stretch, the more.
Well, and like people don't realize like they don't have the back support for that.
Yeah.
No.
Like I know so many friends that have back issues because they got way too big of implants at 18.
And I can second this. Like I've been in the OR with you. I've seen you remove implants that are huge. And they've been in there for years. And once you remove the implant, it is just a skin flap. Like that's what it looks like. Like your skin is stretched. It's a skin flap. You have to refill with big breast implants. So it's like if you fill with big breast implants, do you have to keep refilling with bigger breast implants, or can you go smaller?
No, you can always go smaller, but then at that point it's more of a reconstructive surgery, right? Because you have this huge pocket that's been stretched, and somehow you have to shrink that pocket back down with either like sutures or, there's different techniques to do that, and then kind of reset everything and then cut away the loose skin or
not ideal.
It's not ideal. And so I always tell women, you don't see older women with small breasts. And why is that? Your breasts grow your whole life. They keep growing. They grow with, puberty. They grow with pregnancies. They grow with weight shifts. And then they grow when you go through menopause again. So your breasts only get bigger. So even if you put in a small implant in your 20s, and when you're in your 20s, you're a B or C cup with your implants, by the time you're 50, that same size implant is going to be like a D or a double D. And people are like, your implant's not growing. It's your breast tissue.
Yeah, your estrogen levels change, and you're gonna change breast tissue size.
Yeah. So I always say start small. You can always go bigger. It's so much harder to kind of undo the damage that's done by bigger implants.
For sure.
Yeah, with the trends, I feel like it's very hard to like. What if you get big implants, and then in 10 years, that's not what people are wanting now.
No. So
like, what are people doing? In the 2000s, they got these huge implants.
Yeah.
And now they're like, what do? I hate this, and I want natural breasts.
That's why it all goes back to like go find the surgeon, like look at their work and trust them to pick the implant size that's going to look best for you.
Yeah.
Because that's ultimately like let them do their job to the best ability and like but make sure you do your research on who you're going to.
See, this is how we feel about lip filler.
Yeah.
It's hard,
Yeah.
You're like, it's all up to your anatomy.
Yeah.
So, but, Car, you had a question, a good one, about breast implants and motherhood.
Yeah, I feel like it's really common to get breast implants in college or before.
Yeah.
And a lot of people always have questions in regards to breast implants and breastfeeding. We can touch on it after you answer that question, but I had my breast surgery after my third baby. And like, I'll go in. Anyway, you answer first the question of, okay, so if I get breast implants before I have babies, can I still breastfeed?
Yes. The short answer is yes. The long answer is that there are a lot of things that go into breastfeeding that people don't take into account. Like, your hormones all have to line up. You have to make milk. Your baby has to latch. So all of those things, if you're never been a mother, there are some unpredictable factors.
For sure.
But the implants themselves don't affect your ability to breastfeed. I 99% of the time place the implants under the muscle, away from any of the breast tissue or the ducts. Another reason that I go in through an incision on the underside of the breast as opposed to around the nipple. You can disrupt some of the ducts if you go in through that.
And cutting in the nipple.
So that's why I like to go under in the fold of the breast, and that way you kind of avoid all the important structures that way as well. For other reasons too, that incision is my preferred one.
But going back to, I think going back to the whole concept too of reconstruction versus like aesthetically pleasing, like obviously, like no one but my husband is looking at my boobs, but after you breastfeed, like you said, your breasts change so much. So like think of a small implant, because when your milk comes in that first time, like I didn't have implants in for my first baby, and it literally feels like you got implants overnight when your milk comes in. It's wild. And I can't imagine having like a 500 cc implant and then your milk comes in, and the gravity of that, like
that's crazy.
It would be
I didn't even think about that.
Yeah.
So do you recommend, if you had to say, breast implants before pregnancy or after kids?
That's such a hard one. It's definitely a case by case basis. So like the thing is, if you're not going to get pregnant in 2 to 3 years, if you're like not actively trying to get pregnant and you really want breast implants, I say go for it. There are so many things that may delay you having kids, and those could have been years where you're like feeling more confident and feeling great about yourself. You could have trouble having kids. You could, so many things could happen in that time.
Yeah.
So if you're not actively trying to get pregnant, I say go for it.
Yeah. So for me personally, like obviously this is a very personal story, and so it's like everyone's going to have a different story. But after breastfeeding 3 kids, I had 0 breast tissue left. It was wild.
Yeah.
Like literal flaps of skin, like you said.
Yeah.
And that as a woman, already kind of after sacrificing your body is really demeaning.
Yeah.
And when I was in a swimsuit and I'm chasing 3 little boys around the pool, like I felt really bad about myself. And so it was something that I could do to be feeling better.
Yeah.
So for me, it was a no-brainer. So I went to Dr. Khan and I told her I for sure am not having a baby for like 5 years. It wasn't off the table for us completely. We may have one more. And so it was a no-brainer, not a no-brainer, but it was a very educating conversation. And she said, well, if you're not having a baby immediately, like, and you feel bad about this, then you should do something about it. Like you should fix it. And so I say, and like, I know it's silly, but like getting breast implants was like the best thing I've done for myself personally in like the last 5 years.
Yeah.
Because it made me feel like I could be in a swimsuit again, and I felt, I don't want to say sexy because I think sometimes that word is like ugly, but like I felt like womanly again.
Yeah,
you know what I'm saying? Like
yeah.
I felt like my top half matched how much energy I had.
Yeah, and you also feel like you get a piece of you back, like your body back, because
1000% that I sacrificed.
Exactly. And
Yeah.
like people don't think about all the things that women have to sacrifice through pregnancy, through birth, and
Yeah.
I just think it's like the best thing you could do for yourself after.
I do. I
know?
think it's so healthy to correct the things that will just make you feel better.
Yeah.
And some people it doesn't bother them. And I
Yeah.
hope that I just wasn't that person.
Yeah.
And one of all my kids breastfed on the right side more than left, one hang lower. It was so
Oh my
unfortunate.
gosh.
That it felt like
Yeah.
if this is just something I can do, like how fantastic. And and like really pain tolerance for people that are nervous about the pain. Like pain control is so easy now. I literally was I was on narcotics for like less than 24 hours.
Yeah.
Because I don't take well to them. And so I switched very quickly and was totally fine. I joke that it was like a surgery-induced vacation for a week.
Yeah,
It
literally.
was perfect. Yeah,
That's
it was
so
really
funny.
nice. I mean, not even
That's
how
so
many
cute.
days off do you say they have to take from work?
It just depends on how active your job is. I do like to have people kind of lay low for about a week.
Yeah.
If you're at like a desk job or you're work from home and you're just doing emails from a computer, honestly, you could go back after like a day or two once you're off the pain medications.
It's wild.
You know, if you had like a midweek surgery, just take the rest of the week off and go
Yeah.
back the following week. If you have something that's more labor intensive where you are having to be like up on your feet, surgery just takes out a lot of your energy. And so just getting your energy back sometimes can take a little bit. So I usually say give yourself a full week to recover. Also for driving and things like that, I don't love for my patients to start driving right away.
Yeah.
So I usually say about a week off from work, and then you can kind of go back in and do, some light activities.
Because you cut the muscle. I think that's the most painful thing.
Correct.
So like Dr. Khan said, the breast implant goes under the muscle. So it's weird movements. Like I remember like wiping down my kitchen counters.
weird.
Like that movement hurt.
Yeah.
But then other movements, like you don't feel any pain. So
Yeah.
you kind of like
It's so crazy.
T-Rex
You're the
arms.
dinosaur
T-Rex
arms.
arms
That's
for
what I
like
would always tell
a couple
people.
weeks.
Okay, my last question that I have for you is, this also might be like a little bit of a tough one, but how young is too young for breast implants? I do feel like just like Botox and fillers, it's moving younger and younger and younger, and maybe because it's more acceptable and shown on social media now. What is the youngest you've gone in office being like, I want breast implants?
Obviously, they have to be 18.
Yeah.
You have to be able to consent for yourself. But I think 19, 20 is probably the youngest patient.
Yeah.
Like I said, I had one that was 19. You actually cannot have silicone by FDA guidelines if you're under 22.
What?
Oh,
Yeah.
wow. I didn't know that.
I didn't know
Yeah.
that either. What
So
if
you have to
someone's
get saline.
What if someone's under 18 and comes in with a parent?
Oof, that would be hard. Unless they had some significant asymmetry. When we were in residency, we'd have kids, who had congenital issues and things like that had
Where
a
they
lot of
like don't develop a breast.
yeah, where they don't develop a breast.
Yeah.
And in that sense, it's reconstructive. So we would have some younger patients. But, and even like my breast reduction patients, some of those are younger because that's like a functional thing, right? But I would say for breast implants, purely cosmetic, 19, 20 is probably like a reasonable age.
I didn't know that you had to be 22 to get silicone.
So what, like, is there a reason you choose silicone over saline? Like a kind of fast answer or no?
No, it's usually patient preference. I mean, I think silicone feels and looks more natural than saline. Saline's just salt water in a bag, and so it tends to feel a little bit more firm. You get a little bit more wrinkling and rippling with saline. But some people just like the idea of knowing that it's just IV fluid in the bag. So if it does, so if it does leak or have an issue, your body just absorbs it. And you know right away that it's leaked, whereas silicone, the leaks are harder to detect because the silicone's technology's gotten so good that it doesn't like deform your breast if it leaks. Sometimes you just don't even know. It kind of stays in place like Jell-O.
That's interesting. That's so cool.
I have silicone and I really like them.
Yeah.
Yeah. Honestly, like I don't even really notice them anymore.
Yeah.
Which
They
is
become a part of
ideal.
you.
Yeah.
Yeah. I want mine done, but me and Dr. Khan, we talk about sizing often.
Jenny is one of those patients that has
I
some
like my
unrealistic
friend has 400
expectations.
cc's, so I want 400 cc's.
You are the problem.
I'm the problem.
Yeah, you are. You really are. I'm like, Jenny, you are a small human.
I'm like, okay, so 500 cc's.
No chance.
Okay, my very last question. We can wrap up. What's the thing that surprised you most about your career that you didn't expect?
I think just how much I like genuinely love going to work every day. And how much like I love my patients.
Yeah.
I think it is one of those things like on the weekends, everyone's like, oh, I don't want to go to work on Monday. And I'm like, I have surgery on Monday. That's going to be great. I am so pumped to like go in and do surgery.
Yeah, it's fun.
It's so fun. And
Jenny and I talk about though, I'm like, oh, surgery sounds so stressful.
I know.
It seems like such a crazy procedure when you're not a surgeon.
Yeah.
no, it is. And I don't take it lightly. I don't want people to like think that I just like go in and it's a great time. I mean, I worry a lot about, things and like things keep me up at night.
I'll never forget. So my background as a nurse, I did work in the NICU for years. And so I watched a lot of C-sections. C-sections are wild.
Yeah.
Like so wild. And I'll
So
never
wild.
forget after watching so many C-sections, and that seemed like the norm to me, to going and watching one of your surgeries. It's the most controlled, safe environment I've literally ever seen in my entire life.
It
I'm
really
like,
is.
she said shed one drop of blood.
Yeah.
I'm like, what? I'm like, where are all her bodily fluids?
Yeah. No.
Plastic surgery ORs are just
Very
meticulous.
controlled. Yes.
Like to a
Very
it's
clean.
shocking.
Like something drops on the floor, like a betadine. We wipe it up right away.
I mean, it's just like
Like literally, that's like what we do.
We're a little OCD in there. But yes, I mean, it's elective surgery. It's usually moms or like young people. So like I do not take it lightly. It is a huge deal to go through surgery.
Yeah.
Like everyone's like, oh, is it a minor surgery or a major surgery? In my opinion, any surgery is major. You are putting your self under anesthesia and there's some unpredictability to that. So I always say, I don't take those things like as lightly as some people think. Oh, it's just like a quick breast dog. No, it's like that's somebody's mom, that's somebody's sister on the table. So like you want to make sure that like what you're doing is, the benefits outweigh the risks ultimately.
Yeah.
are your parents glad now that you did it?
Yes, I think so. I think so.
No, but coming full circle now, your parents and your parents have moved out here.
Yeah.
Because everyone loves Arizona.
Everyone loves Arizona. Just working
love
at my
Arizona.
brothers now. They're New Yorkers, so.
Well,
getting
we
them to
love
move
that
in.
you're out here,
Yeah.
and I just love that you're so like excited. Like I don't know, I can just feel the excitement when you talk about plastic surgery in your job, and it's just I feel like
I
it's
think
so
it
great.
reflects in like your clients' outcomes.
It really
too.
does.
Oh,
It
you
seriously
guys.
does.
No,
yeah.
she's so talented, you guys. It's crazy.
Yeah, it's insane. It's the best.
You're making me blush.
Okay. Anything else? Any last tidbits you need to share?
No.
No, we kind of drilled
Yeah.
you.
We're just excited that you came on.
Yeah. No.
And we'll for sure have you back on. We have so many more questions about everything
We
else.
didn't even get into like tummies or really faces, like
nothing.
so many other
we just
things.
talked breasts,
lot
so
about
there's
breasts.
so much more to talk about.
Yeah,
so.
let us know what questions people have. Happy to.
Yeah,
answer them.
exactly. Thanks for joining us. Listen on Spotify. Please rate and review on
Like,
iTunes. Follow. Check us out on Instagram, TikTok. Anywhere you listen to a podcast, I'm sure we're there.
Yep.
So, yes.
Okay, love you guys.
Thanks for joining us, Dr.
Bye.
Khan.
Yeah, thanks for having me.
Bye.